I thank the member and I call the member for McEwen.
Thank you very much, Mr Deputy Speaker, and it's always a pleasure to get the opportunity to speak in front of you. To use a bit of time there. Today I rise to once again to add my voice to the countless voices of my community who are demanding that the governments take action seriously to the threats to our population through lack of access of quality, affordable aged care. And it's always good to follow my friend Dr Freelander, the member for Macarthur, who is very well versed and knowledgeable in this area, and his expertise is something that we're lucky to have on this side of the House. The report highlights what so many in our communities have been shouting from the rooftops. We don't have enough places to provide care. We don't have enough carers to do the task with dignity and respect that our ageing friends and family deserve. It was only last week in the House where I was speaking on behalf of thousands of concerned residents who lent their voices to the Doreen Seniors Club petition, Spotlight on Aged Care, calling on governments to establish an aged care facility in Mernda or Doreen to meet the needs of the growing north. This is one of the fastest growing regions in Australia. The urgent need for increased access and service can be seen in full view. We know it, our communities know it. The only ones who don't seem to understand these issues for years are governments. Time and time again on this side of the House, we've asked the government to address the fact that aged care system is in a state of crisis. With that in mind, and with this opportunity to once again address this critical issue to our community, I'd like to, if I could, seek leave to table a petition by 2,000 local residents of Doreen and Mernda surrounding areas. The petition calls on government to take action in our local community and make the necessary investment to bring critical aged cares to our community.
Is leave granted? Leave is granted.
I thank the government for this, and I thank the intelligent members of the government for this, for letting us through, because it's vitally important that we address all calls from the community, because our inquiries are just not enough. Reports like this one that we are discussing here today are important, but what's needed, as Dr Freelander, the member for Macarthur, said, is real action and a real plan. There have been several inquiries over the years into problems in the aged care sector, which the government's refused to simply act on. We know from this report and from the stories we hear from local residents that the quality standards and reporting system just isn't working. There isn't enough aged care workers and they aren't given the right pay or respect or support they need. Despite what the Abbott, Turnbull, Morrison government might have you believe, you don't fix aged care by cutting funding. The opposition leader and the Shadow Minister for Ageing and Mental Health have already written to the Prime Minister urging him to broaden the terms of reference of the recently announced Royal Commission to include a range of issues that at this point seem to be totally ignored. Billions of dollars have been cut from aged care in the last 5 years under the Liberal National Party governments. Current Prime Minister himself cut almost $2 billion in his first year as Treasurer. We wonder why there's a crisis. There are 108,000 people on the home care package waiting list, including 88,000 of those with critical high needs, many living with dementia. Those 108,000 Australians deserve some answers. They deserve respect and they deserve dignity. We should judge ourselves as a nation by how we treat our elderly, and right now it's fair to say we are failing the basic test. How can we call ourselves fair and a generous country until we give elderly Australians the love, the care and the comfort in their sunset years which they deserve? So with the ever-revolving cabinet door, 3 ministers in 5 years and billions cut, the government has ignored dozens of its own reports and reviews of what's needed to fix the problem. And only after a shocking report on 4 corners did we see any movement. These reviews and reports have been allowed to collect dust instead of being acted upon. It shouldn't take bad press to get some action. We shouldn't wait for the minister to say, oh, look, if it lands on my desk, I might have a look at it, but otherwise let it go. We shouldn't only care about ageing citizens when they are in desperate crisis. We also know the role of nurses and personal care workers in the care of our older Australians is absolutely critical and will only become increasingly important as demand continues to grow. Labor also understands the important role of other health professions such as GPs, occupational therapists, physiotherapists and dietitians play when you look at a holistic approach to the well-being of our older Australians. The number of people aged 85 years is rapidly increasing comparing with younger age groups and is projected to double by 2032. What we are going to need is a tripling of the aged care workforce in the next 30 years to provide a standard of living and care for this growing proportion of older Australians. And where is the plan to address the shortfall? It's nowhere. Where's the focus on quality training and retraining in the aged care space? It's gone with the wind. Reports show us that predicted aged care workforce requirements will need to increase from around 366,000 people to around 1 million by 2050. So what did the government do? They dumped Labor's $1.5 billion workforce compact and supplement after the 2013 election, which totally undid the groundwork for a comprehensive aged care workforce development strategy to address those issues of training, staffing levels and an ageing workforce. It wasn't until almost 5 years later the government finally addressed some of these issues with the Aged Care Workforce Task Force in the 2017-2018 budget. A day late, a dollar short. We know that in order for any strategy to address the shortfalls in aged care to work, the government must work with unions and aged care providers to implement a clear strategy to meet the growing demand. And I mean an actual strategy, one that considers the issues such as the proposal for 24-hour registered nurse coverage at residential aged care facilities. Whether it's aged care providers, workers or consumers, the message up to now has been frustratingly consistent. It has been one of reaction or inaction. The Abbott-Turnbull-Morrison government can and should get proactive to ensure we have an adequately skilled and equipped aged care workforce to care for our population as they age. While the chaotic and divided Liberals have fought amongst themselves, the care of older Australians has been neglected. Thank you, Deputy Speaker.